Okay, why don't we go?
Okay. Yeah, so it's almost 5 after, so let's kick it off. Welcome everybody, thanks for joining. I'm looking at the names here on the side and actually recognize most of you and see people from not only all over the US, but also all over the world. Welcome Simon from Australia. So we're here together to discuss today, what is all of our mission and goal, and that is to protect healthcare, to make healthcare a more secure and safer place. And we have with us as the main presenter today, Thomas Millar from CISA. And Thomas will share with us some of the work that CISA and sister agencies like, for example, HHS have rolled out recently, resources and tools you can use both on the healthcare provider as well as on the medical device manufacturer side. So many of you are probably already MedISAO members and you're interested in improving your cybersecurity capabilities. Others who are on the call and are not members yet, please have a look at MedISAO and see if you want to engage with us in any way, shape, or form. And with that, thank you, Thomas, for joining us today and taking the time to spend with us. And it's all yours now.
All right. Well, thank you so much. So hi, everyone. My name is Tom Millar. I'm from the Cybersecurity and Infrastructure Security Agency, which I'm going to go into a lot more detail about what that means in just a second. I've been working in CISA is part of the Department of Homeland Security, and I've been working on cybersecurity in the department since 2007. So I have a long history with the agency and our national level sort of cybersecurity efforts to defend the nation from cyber attacks and adversaries. And today we're going to talk about a lot of the different resources that are available from our agency to help you protect your networks, your systems, your customers, your data, and also to from a prevention perspective as well as a response perspective. Should that worst case scenario happen and you are victimized by a cyber incident, we have resources to help you minimize the damage and get back on your feet safely and soundly. So with that, what I'm going to do now, I'm going to start sharing my screen, and we're going to. All right. Well, okay, that didn't work the same way it did in test. So I'm going to start sharing my screen, and for a moment, we're going to get that, which I apologize for. And here we go. This is what I want to share. So this is a selection of resources I've curated for specifically the healthcare and public health sector. And I hope these are going to be useful to most of you. And we're going to walk through these and explain a little bit about why I selected them, what they all mean for you, and how you can leverage them in your day-to-day efforts trying to secure medical devices and medical and healthcare providers from cyber attacks. And we actually have CISA, as you see here. There's our fancy little seal. Actually has a broad range of missions, not just cybersecurity, even though that is the first word in the name. We also do infrastructure security, like we will be involved in trying to help ensure that the Super Bowl is going to be safe and sound. We regularly have teams assigned to that event. We do emergency communications, just like all your 911, and interoperability with police and EMT radios, fun stuff like that. National risk management, which is sort of maintaining a register and like sort of a national level concept of what the risks are to the American economy, our way of life, and all that sort of thing, and making sure that we're paying attention to what those risks could turn into. And then we also do recently, I'll talk more about these. We published playbooks that I think are very handy for anyone. These specifically say for federal information systems, because that's the way the homework was assigned to us by the White House. But I think these playbooks, and we'll talk more about them later, can actually be leveraged by anybody. So they're kind of like homework helper for anybody who's tasked with trying to write SOPs or playbooks for their own organization. We work together with the FBI with our Australian counterparts, the ACSC, and the National Cybersecurity Center in the UK, and put out a publication on specifically an Iranian government-sponsored APT. That may not be the kind of thing that your organization is worried about, but it is just an example of the different roles that we play. Real quick, since we do have a lot of time today, I want to dive into our regions to show that we're not just sort of another DC bureaucracy. We actually have regional offices all over the country in the US. And you can look up any of the regional offices and get contact information. These are great people to know. So we have cybersecurity advisors and protective security advisors under, up here. You can see all the different types of advisors and inspectors that we have regionally. And we cover the nation. So this is usually a lot of people's first point of contact with CISA. If you need something from us, is to go to your regional office and find out from them what they can do for you. And these are great partners to have in case of an incident, or preemptively if you just want to get an assessment performed on site. You want to leverage the regional resources. So with that, I want to go to our recent initiative to help prevent and minimize the damage caused by ransomware to the country. StopRansomware.gov. I know the URL up here says CISA.gov/stopransomware, but it's actually like StopRansomware.gov is the really easy to remember URL that takes you right to this exact same page. We have tremendous amount of resources here on basically how to keep your network safe, how to report a ransomware incident, and also what to do when you are actually hit by ransomware. Because for many people in different industries, that is a matter of when, not if. Ransomware gangs are extremely active, and they are not taking any prisoners at this time. I want to talk a little bit about the resources. And apologies, Alex, just let me know if I'm flying through this content a little bit too fast. I'm very familiar with this brief at this point, so sometimes sometimes it turns into a fire hose, and I do apologize. But the resources is just a page where you can land on a lot of different things that we've made available for people who want to consume all of our information on preventing and minimizing the damage from ransomware. I'm going to point out one that is particularly relevant. So if you were going to go down to this campaign page, you'll see we have resources for, like just generic a toolkit, one for K through 12, which we built very early on in the process because we saw a lot of school systems being hit with ransomware and taking them down while they were trying to do remote learning during the pandemic. But we also have the healthcare resources page. And this one we're particularly proud of because we worked really hard together with our partners at Healthcare and Human Services and with the Healthcare Sector Coordinating Council to make sure all of their resources are available on this landing page. So you can see here that Health Sector Cybersecurity Coordination Center, their information is part of this page. The 405D resources are all here, including contact information and various ransomware resources that we've also added. And this keeps going. So there is a lot of stuff here on different preventative measures that you can take to ensure your systems are protected from ransomware. And for example, what to do when a ransomware event hits your organization. So let me pop this one open real quick. This is a really simple one page sort of response template that we created to help healthcare, especially healthcare delivery organizations, in case they're hit with ransomware. The idea is that you would use this template to create your own guide, and then have that in the form of a hard copy that is readily available to your team at all times. Because if you are hit with ransomware, sometimes the hardest thing is realizing that you may not have access to your bank accounts, your accounts receivable or accounts payable systems may be locked up, your email may be locked up. You may not have access to any of your normal IT resources. So having a hard copy of this with the numbers to call can be crucial for sort of minimizing the damage and responding as quickly as possible. You see we have our own contact information there, central at CISA.dhs.gov. That is our 24/7 watch desk that handles all different types of reporting for us. You know, you fill in your field office for FBI, Secret Service, or local law enforcement, whoever you decide is most appropriate for you to get involved. And having your, over here on the left, identifying your incident commander in advance, you know, identifying exactly which lawyer is going to be on call, or who are you going to speak to, and who is going to handle public relations. All of these leadership roles are really important in dealing with a crucial incident like a ransomware attack, or a severe attack like a ransomware attack. And that's why we created this one pager, so that everybody thinks about this in advance, has this sort of on file or at the ready. And hopefully that can help people minimize the impact. We're very concerned, obviously, when a healthcare delivery organization gets hit with a ransomware attack. That can have potential safety critical healthcare outcome issues can be caused by that. We know, like, patient outcomes can be negatively impacted by just a few minutes or hours in delivery of care. So that's the kind of thing that we want to make sure is avoided by any sort of ransomware attack affecting a healthcare delivery organization. So all that said, now I'm going to introduce you to what we call, or what I call, is sort of our pocket constitution for dealing with ransomware. This is developed by us and our multi-state information sharing and analysis center. This is a partner that we sponsor, the MedISAO, to help us cover all the bases when it comes to state, local governments, and their needs for cybersecurity and other types of security as well. MedISAO has been a partner of ours for a long time. They're really good at what they do. So we work with them together to create this specifically. Originally, this was written for, obviously, like state and local governments. But again, the advice is evergreen, and the advice is broadly applicable to any type of organization. It lists a number of different types of infection vectors that are used by ransomware. These also are relatively evergreen, even though ransomware actors continue to evolve and learn different types of exploits they can use to take advantage and gain presence on a network. Most of these are, like it says here, general best practices and hardening guidance. That's exactly what they are. And we'll get into some other examples of that sort of advice as well. My favorite part of this is similar to that one-page template that we showed you just now, the response checklist. And this is, again, something that is probably best kept in the form of a hard copy that you can readily reach for in case the bad thing, that the worst possible scenario does happen to your organization. Walks you through the steps for sort of triaging and isolating systems, walks you through how to engage with CISA and with law enforcement, contain and ultimately eradicate the ransomware infection, and get back online safely and securely. I love this guide. I will, I would gladly hand it out if we were in person, but for now, you'll just have to take me scrolling through a PDF online for right now. And again, this is all available from the resources page on the stopransomware.gov website. This is probably the easiest thing to find, since it's right up front and center on our resources page. All right, so that's enough about reading material. I've told you all about different things you can go, like, in your spare time, read this, in your spare time, make this template up, all that sort of thing. Now I'm going to talk about tools and services a little bit. So and let me introduce you to the Ransomware Readiness Assessment, which is part of our cybersecurity evaluation tool. This is on the official CISA GitHub site, where we store a lot of different tools that are available to the public. But this one in particular is standalone, barely requires any configuration at all. You just download it, and then whenever, I like to joke, like, whatever time you were going to spend taking some online personality quiz, you can do this instead. and you'll have results that you can actually apply to improve your cybersecurity posture. Instead of being able to tell people that your personality is actually purple or whatever. So we've done lots of iterations of the CSET. There are many different modules, but the one that we are proudest of lately is this ransomware readiness assessment that we built really quickly, actually, in order to make sure that stopransomware.gov had an accompanying assessment module. So all you do is download the application, fire it up, start an assessment, answer. It's basically a questionnaire, sort of a structured interview that you can take on your systems, and you answer everything to the best of your ability, and out the other end comes a suite of recommendations, like I said, to improve your cybersecurity posture and better defend your networks and systems. So this is a very popular tool. A lot of people have gotten a lot of value out of it. It's continually updated. I think, so you can see here, it's like been updated in June 2021. And I think shortly there will probably be another update to that to make sure we're keeping this content fresh. Next up are some other tools of a sort. This is the pragmatic cybersecurity webinar that we delivered. So after you have had enough of me talking about all these different things on this webinar, I encourage you to check out this stuff from our CISA COVID task force. So this is my good friend Josh Corman, explaining the rationale behind the Pragmatic Cybersecurity Series webinar, why we put this together, and what the content basically helps you do. We have our bad practices. All these people are my buddies because I was on the COVID task force with them, and we worked together through some pretty tough times. So like fellow veterans of CISA under great duress. So this is my friend Bo explaining what we call our bad practices. Let me hop over to the bad practices real quick, and you can see what I'm talking about. So the bad practices is a simple catalog, and right now it's only 3 things, and it will never probably be more than 6 or 7 things. But currently it's just 3 things that we know uncontroversially, these are ways that will get you compromised. So that's why we call them bad practices. Instead of saying, oh, here's a list of 54 or 20 or 90 things that you should follow that are best practices, we're saying specifically, these are bad practices that you should not do. Wherever you can avoid these, you shouldn't do them. And they are, right now, using unsupported or end-of-life software, using known fixed or default passwords and credentials, and using single-factor authentication for remote or administrative access. All of this is tied to specifically critical infrastructure. Obviously, if you do any of this stuff at home, that's your own problem. But specifically in a critical infrastructure environment, we'd really like to see a world where none of these practices are present. And unfortunately, sadly, we do know that they are. And a lot of critical infrastructure, unfortunately, still relies on end-of-life unsupported software because various things have happened in the software supply chain. Things aren't getting updated correctly. But we know that there are fixed and default passwords and all kinds of things that are in some cases safety critical systems. And single factor for remote administrative access remains highly prevalent, much more so than we would like. But by publishing these bad practices, we hope we finally start to discourage people from any of those things and get them back to sort of more, like I keep saying, a healthier cybersecurity posture. So, whoops, lost my link. Anyway, so that's basically the main thrust of the Pragmatic Cybersecurity webinar. I also want to talk about the second and third part of this Pragmatic Cybersecurity series is CISA's Stuff Off Search, and where did it go? All right, we're just going to have to back into it. Stuff Off Search is an initiative we took in the COVID task force to help people get their most sensitive technologies off of the publicly routable internet. So if you are familiar with any of these search engines here, Thingful, Shodan, or Census, what they all do that distinguishes them from a normal type of search engine, they're specifically designed to help you find particular technologies that are exposed to the internet. And that can include, and often does include, industrial control systems, or what we call industrial Internet of Things. It includes SCADA systems, supervisory control and data acquisition, remote access, and other types of critical assets, including, like we were just talking about, unsupported software or end-of-life systems that are still exposed to the internet. So what we did was we created a primer and some simple hands-on guides that walk you through the process of identifying where you might have these types of sensitive technologies exposed to the internet in ways that these search engines can find them, and then removing them by like putting them behind sort of a protective layer or DMZ, or otherwise isolating them from the network so that they're not exposed. All of that, again, is to improve the posture of your organization so that you're making it just that much harder for the adversary. This is all about these, and the bad practices, I would say, are both about ways, both really about making sure you're not low-hanging fruit for ransomware actors or any other type of adversarial folks that are out there trying to take advantage of your systems. And lastly, the other part of the final part of the Pragmatic Cybersecurity webinar is our CISA tabletop exercise packages. And these are, you can see these are really wide ranging. So we have packages for all sorts of scenarios that you might want to think of. We have situation manuals or scenario manuals for all different types of ransomware attacks, for phishing by a vendor, for cyber insider threat. We have some convergent scenarios for different types of sectors. Unfortunately, as of yet, we don't have a great deal that are specific to ransomware, not ransomware, for healthcare sector types of attacks. But you could probably get some value out of industrial controls, ransomware, and the insider threat packages. And the great thing about this is, like, we're not coming to facilitate the exercise for you. We can't always scale to that degree for every critical infrastructure organization across the country, of which there are thousands and thousands. But we made these packages available to make sure that people are able to run their own scenarios and walk through the exercises. And here's all of the different the planner handbook, facilitator and evaluator handbook. You get the idea. So we've done a lot of homework for you. So if you want to start your exercise plan or add some CISA flair to an existing exercise program, this is a great resource to have available. Now, next up, and we're starting to get to the end here, but if you want to know how to find out that all these different resources are getting updated, or if you want to find out what the most timely information we have is on threat activity, or find out what the latest vulnerabilities are that are out there that you need to be aware of, you can subscribe to our National Cybersecurity Awareness System. So that consists of 4 different types of products that we put out to the public worldwide on a timely basis. The first one is called Current Activity, which is usually like 1, 2, maybe 3 paragraphs at most. This is really frequent. So like it's frequent, but it's very lightweight. And I love this one because it tells me a wide variety of different types of information. It tells me every time there's a Patch Tuesday, what's in that Patch Tuesday and what I need to pay attention to for any type of major vendor in IT. It also tells me when we've updated a product, or when CISA is publishing something with a partner like the FBI. I think today we are going to be putting out something. The FBI is publishing something, and we're going to be doing that in partnership with them. So that's something else you'll see on Current Activity later today if it hasn't already gone out. So Current Activity, like I said, very lightweight, very frequent, wide range of different topics. But I find it highly valuable for my own situational awareness. And I work at CISA, so you'd think I already know everything, but it's too much to keep track of. Current Activity makes it easy. alerts. These are much more in-depth. These are like going to be a whole page. They're going to contain technical indicators of compromise. They're going to contain more details of a vulnerability, or they'll contain like, if you're familiar with detecting malware, they'll contain specific different types of YARA rules or something like that. So the alerts are primarily threat focused, although they do often come out with specific emerging vulnerabilities that are being exploited in the wild. We will publish alerts about those as well. Those are not nearly as frequent as current activity, because not everything that happens rises to the level of an alert. But when they do come out, they're definitely worth paying attention to. Actually, since we do have the time, I'll just give you a quick tour of that. So you can see here we have different ransomware families that received alerts specific to their indicators of compromise, so that you can try to detect them early and contain them on your networks. We have multiple things about, like the public exploitation of this particular vulnerability that we saw and wanted to make sure everybody was aware of. And Log4Shell and other Log4j vulnerabilities got a big note that helped ruin a lot of people's Christmas time. So hopefully nobody on this call had too much of a problem with it, but that was a big thing that we were handling for a while and continue to handle to this day, in terms of coordinating the disclosure of all the different types of systems that have Log4j vulnerabilities in them. So that's the kind of content for the alerts. Like I said, they don't come out as often. I believe this number here is actually the Julian date. Yeah, I think it is. So that's about how often they come out. They come out every maybe 2 weeks to 30 days or so, or sometimes not even as frequent as that. But then there's bulletins, which come out like clockwork on every Monday, because these are weekly periodical summaries of all the new vulnerabilities we've become aware of through the Common Vulnerabilities Enumeration Program. I think this is another one of those things that's not especially like intellectually stimulating, but people get a tremendous amount of value out of this because it helps them prioritize their week of sort of managing patches in their environment. And analysis reports, these are very in-depth analysis reports of specific types of threats. So basically, unless you are specifically involved in sort of detecting and dealing with malicious code in an environment, if you're if you run the Security Operations Center, then this is the kind of information you should probably subscribe to, but it's not for everyone. Simply because it gets very sort of in the weeds technically, and it's very detailed about the different types of threats that we publish on. And again, that comes out as approximately as often as the alerts. So just to go back to that real quick, and now the back button's not working for me. Anyway, back to NCAS. Subscription is really easy. You just populate your email down here, or you can also follow us on via RSS and other feeds. And then there's Twitter. So we have our Twitter where all of the current activity and the alerts go out as with an accompanying tweet, so that you can follow us that way as well. And so that's all of our the main tools and resources I wanted to make you aware of before I get into the real meat of this today, which is our cyber hygiene services, and in particular, one type of assessment service that we don't publicly advertise, but I think is going to be very interesting to the medical device community. So the cyber hygiene services are a family of 4 different services, sort of in escalating degree of how resource intensive they are, and how detailed the results are going to be for your organization. But our vulnerabilities, they're all no cost. I think that's very important to say. And all of your data is kept confidential. The data that we collect in the performance of these assessments is your data. We do summarize and abstract it for our own analytic purposes so that we can get a better idea of a sector-wide sort of risk picture. So we do that, perform that level of analysis on it, but not specifically to any particular customer, because every stakeholder's data is that stakeholder's data, and it's kept separate. It's not available for regulatory purposes. It's generally protected from FOIA. All of our information is considered proprietary, which is usually one of the big red flags for something that is not releasable under FOIA, is whether it is proprietary to a private sector entity. So we have some protection from FOIA that way. We can also arrange for other types of protection of your information if you want to. But generally speaking, like, I've never seen anybody's information exposed through FOIA or Freedom of Information Act requests. And I've never seen us spill anybody's information accidentally about one of our stakeholders. We keep all of your information very close hold. And that's something that's very critical to me, to let you know that you can trust us with your information. But anyway, on to the services themselves. Vulnerability scanning does what it says on the label. You provide us with a list of your IP ranges that are publicly routable from the internet. And then we go and plug those into our army of robots. The army of robots scans for all types of known vulnerabilities on those systems. And then you get a regular report, either a weekly vulnerability report of all sort of your like low, medium vulnerabilities, or ad hoc alerts that come out on a daily basis, or even more timely, about high and critical vulnerabilities that are also found by the same systems. Web application scanning is very similar to vulnerability scanning. It's a little more resource intensive on our side. So the vulnerability scanning, you sign up and you're good forever until basically the sun burns out, or they decide that, you know, CISA doesn't need to be an agency anymore. Vulnerability scanning is an ongoing service, so you're always going to get that report. Web application scanning, we will send you a single report on all the different types of known risks and vulnerabilities we find in your web applications. So you provide us with a couple of domain names of different services or web applications that you have that are out there that you want us to take a look at, and we take a look at what we see what we can find and tell you what vulnerabilities you may want to take a look at and mitigate. Phishing campaign assessment is checking the susceptibility of your organization to phishing attacks. So that's a 6-week engagement. We start with really simple stuff, classic sort of 419 scams, and then ramp up to much more sophisticated spear phishing attacks. And we let you know when people clicked, because once again, sadly, it's a matter of, you know, when, not if, in most cases. And then we explain, you know, give you some detailed recommendations on how to address that within your organization. And it's not just really like, it's not really like boring, useless pablum like trying to tell you, like, oh, you need to make sure all of your staff take cybersecurity awareness training. Like, everybody already knows that. These are more detailed recommendations about specifically what you can do to catch phishing and prevent it from reaching your users, or to prevent your users from clicking on it in an unsafe way. And the remote penetration test. So this is kind of, we really prefer you to have all of these other services or types of engagements first before you ask for the remote penetration test. The reason why is it makes sure that the remote penetration test is going to find problems that are unique to your environment, that aren't already caught by all of these less resource intensive, easier to ramp up services. So the RPT, as we call it, is easily the, believe it's also something like a 6-week engagement. You get one report at the end. And what this is real adversary emulation up to a point. So they do reconnaissance on your network. They find different parts of your footprint that maybe not even you were aware of. They will engage. They will find a way through your perimeter. That's a near guarantee that they will do that. And then once they're through the perimeter, they stop. So the remote penetration test is only right past the perimeter and the DMZ perhaps, but not the classic red team assessment where we're trying to find our way all the way to the crown jewels. So the remote penetration test is basically just perimeter defenses, and like it says here, externally available applications. But these are great services. They are at no cost. I advise everybody start with vulnerability scanning because there's literally no reason not to. and then figure out if you would also be interested in their other services. And now, lastly, I want to talk about something that is on the secret menu. If you've ever been to maybe a fast food restaurant and you've ordered, I think Arby's has the has that one that's literally every single meat that Arby's sells on a single sandwich. Or if you've ever heard of the Mc 1035, that little sandwich that you can get at that crossover between breakfast and lunch at a McDonald's. Anyway, I'm going off topic. You get the idea. We have some things, some certain types of assessments we don't publicly advertise because they are extremely resource intensive. And we don't want just everybody trying to sign up for them at once, because then we would have a backlog heading into the decade range. So, but I'm going to tell you, because this is a small focused community, and I think this is like the ideal audience for this type of information. We have an assessment we call the critical product evaluation. The critical product evaluation is a very intensive assessment, as I think I've already mentioned about a dozen times. It can take between 3 and 6 months. So it's not something where you're going to get a really quick turnaround. But the idea is that we get a specific product from a manufacturer. An OEM provides us with their product or application, and we take it, do a lot of research on it, read the manuals, lead up everything else that we can find out about that particular product or application, and then we walk through serious threat modeling and active hacking techniques to try and find as many problems with that product as we can. So it's very in-depth. It's not a guarantee that we're going to, find every single thing, that every single different type of security hole that could possibly exist in every product, but it's a great way to get a third-party set of eyes on anything that you're thinking about providing to the public, or something that you might already have out there available to the public, so that you can get basically, again, a no-cost assessment of what might be problematic in that product. So I wanted to share that with you today. If you are interested in the critical product evaluation, please, you can get in touch down here at Vulnerability Info, and that can be for requesting cyber hygiene services. So please, obviously, there's no reason not to do that. For the critical product evaluation, you can ask the same distro. But you can also just ask me directly. My email address is thomas.millar, MILLAR, as you see on the screen, at CISA.dhs.gov, just like here. And with that, I think we have 20 minutes almost for question time, which I'm excited about.
Thank you, Thomas. There was a lot of oops, again, echo. Okay, thank you. A lot of great information. I knew a lot of the stuff, but boy, there was good new stuff for me in there as well. So that was, again, great summary. So the line is open. You can unmute and ask questions verbally, or if you want to type in the Q&A, that's another possibility. We have Thomas for another 20 minutes, so make use of it. Maybe while we wait, one thing that interested me actually was the critical product evaluation you mentioned. Is there any restriction in terms of the type of products you're looking at, or is it can it be anything?
Currently, there is not. Our team is basically are very familiar with industrial control systems and with medical devices from years of experience working with our predecessor organization, ICS CERT. So they have experience with lots of different types of systems. One thing we're also trying to do is see if possibly we can get we'd love to get a truck or a car to take a whack at that one of these days. We have also done some work on, actually that brings to mind, we have done a little bit of work on connected automotive systems, not the car itself, but the telematics systems that are connected to some cars via their OV2, OV1, I forget what it's called, but anyway, the onboard diagnostics connector. So we have experience with a wide range of products.
Do you also come on site if it's something that can't be sent to you, or?
I'm not sure that no, I don't think that the critical product evaluation will come on site because of the sheer amount of time it takes to do that type of eval. So they want something that they can have shipped to them, and they're based in Idaho, by the way. But we do have other types of assessments that I didn't get to cover today that are on site. But again, like usually what we prefer is that everybody have gone through the paces with the Cyber Hygiene family of services, so that you've done everything we can do remotely. And then we have a conversation about what type of on-site vulnerability assessments are most appropriate to the organization and what their goals are. An important part about that is, like, with Cyber Hygiene, it's actually they're all kind of generic, right? They don't take a lot of conversation. You just, we do the paperwork drill, make sure everybody is legally protected while we perform the penetration test or the scanning activities. And then once that is done, you get the activities that are, explained in the paperwork. With the other ones, especially our on-site ones, it's more of a conversation. Like, what are you trying to achieve? What are you trying to protect? And then we sort of tailor our approach a little bit more to each customer with our different types of assessments.
Got it. Okay. So everybody's microphone is open. So feel free to voice your questions, whether you're on the healthcare delivery organization side or the device manufacturer side. And I see a mixed audience here. We have Thomas, so make use of the opportunity. Okay, well, I don't see anybody raising their hand or typing in the chat. So why don't we wrap it then? Give everybody some time back. Thanks, Thomas. This was, as I said earlier, very insightful and beneficial. I hope the audience felt the same. You gave us your contact information, so hopefully you'll get some feedback out of this session, and hopefully the people that attended the session found the resources valuable and found ways to make CISA work for them. Your tax dollars at work, as they say.
That's right. They're no cost because technically you already paid for them.
Yep.
Okay. All right.
Okay.
Well, thanks everybody for having me. I hope you did enjoy this, and please don't hesitate to reach out to me if you have any other questions about the services or the resources we talked about today. Or if you have any questions about CISA or how to engage with us, I'm also available to speak with you about that.
You're great, Thomas, and thanks everybody for joining today. Have a good